Wow, that was the best introduction I think I've ever had. Thank you all very much for coming this afternoon. I hope the information that I provide you will give you a lot of insight as far as what's going on at the federal level for critical infrastructure protection when it comes to cybersecurity. With all of the frustrating things that are going on at the federal level with Congress, I can very much say that cybersecurity time has come. The stars have aligned, and there's a lot of really exciting initiatives in place, which I hope that y'all will all engage with and help us as we move forward. First, I wanted to talk to you about the National Health Information Sharing and Analysis Center. See if I can get this to work. For all of the nation's critical infrastructures, after 9/11, President Bush identified 18 critical infrastructures and identified federal sector-specific agencies that are associated with each one of those critical infrastructures to define a critical infrastructure protection plan that includes physical and cybersecurity and terrorism, kind of all hazards protection. Working alongside those federal agencies and Department of Homeland Security are industry-led information sharing and analysis centers that work on 24/7 cybersecurity threat and vulnerability monitoring. This is how each federal agency is kind of structured for critical infrastructure protection. You have the critical infrastructure, which could be finance or healthcare, supply chain, state government, communications, IT, etc., and the federal sector-specific agency that then has a coordinating council that's broken down into two sub-councils, which is a government council and a sector or private industry council. And then the Information Sharing and Analysis Centers, or ISACs, as we lovingly refer to them, work with that council, the federal agency, Department of Homeland Security, the FBI, etc., to get information out to the sector when it comes to cyber threats and vulnerabilities, countermeasure solutions, but just as important, to get information back from the sector if they've had an attack or if something that has happened. Just for example, when the electricity went out here in San Diego, I know the ISACs were on a call to talk about how is that going to impact all the other sectors and what information do we need to get out to our membership. This is the latest presidential policy directive that President Obama has put out, and if you go to whitehouse.gov, you can search under PPD 8, and it came out in September, and it's really ramping up national preparedness for us to be more proactive than reactive, focusing on prevention, protection, mitigation, response, and recovery to really put programs and guidance documents and frameworks in place to really help us be more prepared as a nation, from the public sector to the private sector to the federal sector. This represents all of the, well, just a sampling of the critical infrastructures. You have a national infrastructure protection plan, and that plan references these annexes or sector-specific plans. As you see on the top over there on the right is the one for healthcare and public health, and there are other ones there like for food and agriculture, emergency services, etc. And you can all find these out on dhs.gov for your reading pleasure. Now, for DHS, for critical infrastructure protection, there are a lot of different departments within DHS. There's the National Protection and Programs Directorate, the Office of Infrastructure Protection within that. They also have a really great program called the Protected Critical Infrastructure Information, or PCII program. And what that is, that really helps support information sharing between the government and private industry. If in financial services, for example, Wells Fargo might have an attack on their infrastructure, well, they can share that information with the federal government without being held accountable or being prosecuted for that information. It protects them for sharing that information so we can find out what's happening on that network before it spreads to other facilities. Also within the DHS, you have the Office of Cybersecurity and Communications, the National Cybersecurity Division. They do cyber exercises. You might have heard about Cyberstorm, national cybersecurity education initiatives that they work on. The NICE initiative is one of those. And I know a lot of you know about USCERT that puts out advisories and alerts every day. Also there at DHS in Arlington is the National Cybersecurity and Communications Integration Center, or the NCIC, and that's the picture in the lower left-hand corner. What the NCIC is, it's a top-secret SCIF. It's like walking into a bank vault. And there are about 80 cyber analysts in there that are monitoring things that are going on around the world from a physical and cyber security perspective. And the information that they have is then given to USCERT for further analysis that sends out the advisories and alerts that everybody sees. The goal of the NCIC is to have a cyber analyst from every ISAC working on the floor there at the NCIC. Right now there are cyber analysts from the multi-state ISAC, which is state government, water ISAC, financial services ISAC, and the IT ISAC. And the National Health ISAC will have a cyber analyst there the first of the year. But they all have to have a top secret clearance, so that takes a little bit of time to go through. This is a representation of all of the National Council of ISACs. You have communications, electric, emergency management, financial services, highway, maritime, nuclear, public transportation, etc. All of the ISACs are nonprofit with the exception of the financial services ISAC. And the multi-state ISAC for state government and the emergency management ISAC are sponsored by Department of Homeland Security. All the other ISACs are membership sustained with their members and have been around for quite a while. Now the National Health ISAC is fairly new. It was stood up earlier this year. Recognizing that with all the health IT and electronic health records and the millions and millions of dollars that was being spent on that, there was not an ISAC in place to address privacy, to address cybersecurity protection, threat and vulnerabilities from everywhere, from a physician's office to a blood bank to a hospital to a healthcare provider, or even technology providers that are supporting the healthcare industry. So working with the National Council of ISACs and Will Pelgrin, who's the chair of the National Council of ISACs, we met with Department of Health and Human Services, Department of Homeland Security, and really worked with them to stand up the National Health ISAC, which we're very proud. That took a lot of work. So we are on calls daily, every morning, with Department of Homeland Security, as well as all the other ISACs, to talk about the incidents that happened for that day and the countermeasure solutions for that, so we can get that out to the sector as soon as possible. When Hurricane Irene was going up the East Coast, I was able to be with a couple of other folks on our teams on a call every day at high noon with Department of Homeland Security and FEMA and HHS and other federal agencies. And I really want to commend them on a tremendously good job that they did during that incident. When I started hearing on the news, did the federal government go overboard, I'd kind of like to have wrung the reporter's neck, because it's never enough to be too prepared. So they did a tremendous job talking about the impact for Hurricane Irene, getting resources in place, lining up the private sector trucks to deliver resources. I was really, really impressed. I think we've come a long way since Hurricane Katrina. So the NHISAC, our mission is really to enable and ensure the public trust by helping with cybersecurity threat and vulnerability analysis, sector-specific analysis, helping with best practice, helping the healthcare sector implement cybersecurity policies, cyber awareness, as well as workforce education. These are some of the services that an ISAC provides, being a trusted entity, and really helps government understand what's going on in that sector, giving healthcare providers, example for public health and healthcare, an opportunity to speak back to federal government. We have secure operations. We're located at NASA at Kennedy Space Center, and people say, NASA healthcare? I don't quite get the connection there. But NASA has been working with implementing electronic health records for over 100,000 employees for several years. And with the retirement of the shuttle program and really opening up their doors to leverage their expertise, it was really a tremendous opportunity to implement a situational awareness center there at NASA. We're also working here in San Diego with iNetworks. So ISAC's redundant facility will be here in San Diego. So we work at doing sector-specific analysis on a daily basis, as well as we're just now next month working with Department of Homeland Security to develop a national cyber exercise DVD for the healthcare sector. And we're going to be working with Liz in securing our eCity to hopefully be able to leverage some of those resources that will be part of that DVD. This is the ISAC framework, what we provide to our members as far as helping them with, I know one of the earlier sessions that I was in was talking on business continuity and risk management. So we really try to help members understand, even from a physician's level, like I said, to a to a hospital or a large pharmaceutical company, to really help implement best practice. We just had our ISAC Board of Directors meeting yesterday. SAIC, McKesson, Johnson & Johnson, Merck were some of the companies that are on the board. And it's really interesting to see competitors come together and want to work on developing a governance framework for the healthcare sector, as well as to help support cybersecurity education. This will give you an idea of some of the cross-sector dependencies, and this isn't an exhaustive list, but within the health sector, if something even from a physical or cyber perspective happens, an incident, it can impact emergency services, agriculture, water, IT, communications, transportation, and especially supply chain. Now that I've told you a little bit about the National Health ISAC, I wanted to kind of switch hats here and talk to you about the Global Institute for Cybersecurity and Research and what we're doing to really address cybersecurity education and best practice in working with national critical infrastructures. The Global Institute, or as we lovingly refer to as GEESR, so none of y'all will forget that now. It was an effort that had been talked about for several years with NIST and Department of Homeland Security as well as NASA about putting a collaborative infrastructure in place to help support bringing together academia, nonprofit organizations, industry, cybersecurity standards organizations, other standards organizations to address cybersecurity issues and really work together and bring down those silo walls. We had our first meeting at NASA at Kennedy Space Center, and NIST was part of that meeting, as well as DHS and NSA, a lot of the security certification organizations in academia and industry. We're also working with the Executive Office of the President and Howard Smith, the National Cybersecurity Coordinator, and the FBI being part of the new National Technology Alliance Council, which was just started in June by the FBI, and it has the top 25 technology companies in the country as part of that council, and each member has to have a top secret clearance because the FBI wants to do a lot better on cybersecurity threats, counterintelligence, and being able to sit down and talk at a top secret level. So we got all together and we said this would be a really great idea, but what are we going to do? So as we were trying to link together, you know, industry leaders and academia and people out there, not only just a national level but a global level, we were looking at, okay, we knew the international strategy for cyberspace was going to be coming out in the spring of the following year, the National Strategy for Trusted Identities in Cyberspace, the National Infrastructure Protection Plan. There's been a lot of policies that have come out of the White House recently, national preparedness that just came out in September, as well as the National Initiative for Cybersecurity Education. So we had a lot of opportunity to take policies and really put activities and programs in place to do a lot of things to help support these with an infrastructure. So these are the core 5 areas of the Global Institute, working on best practice in education and events for professional development, working on critical infrastructures and key resources, or CIKR, situational awareness and intelligence, R&D and the science of cybersecurity, how we're using cybersecurity and why. We're working on some projects with the U.S. Air Force where that's concerned. And then helping to support security policy and global security challenges. This is where Geyser is right now. We're headquartered, like I said, at NASA at Kennedy Space Center. We're working with National University. We're very, very excited about that here in San Diego, and we're going to be working together for Geyser to have a location here on the West Coast, where National University will be the Geyser on the West Coast, as well as leveraging all the great things that National University has, bringing those over on the East Coast, and especially working with the Space Shuttle employees that have been laid off and transitioning them into cybersecurity careers and leveraging a lot of the training that National University offers. So we're very, very excited about that. We also have a location in Canada, in Toronto, in London, and in Sydney, Australia. And this is kind of hard to see, but I'll talk through it. And I thought this was kind of important to really give you a picture how all this is tying together. From a NASA perspective, when we looked at what NASA was doing with the International Space Station and deep space exploration, and especially commercial space exploration with SpaceX and commercial industry now sending rockets and people up into space, we looked at the security aspect of that and said we really need to implement a global situational awareness center that will not only expand the operational support for the National Health ISAC, but will also provide support for a new aviation and aerospace ISAC that NASA, U.S. Department of Transportation, and the FAA are working on, as well as an agriculture ISAC, as well as supporting some of the other ISACs that are out there right now that don't have a security operations center. So our strategic partnerships in that are the Department of Homeland Security, that picture I showed you earlier, that one's kind of in the middle on the right. NASA, like I said, DOT, FAA, DOD, NIST, etc. The picture on the lower left right there is the NASA Space Life Sciences Center. And that is where they do all of when they do an experiment up on the International Space Station in the U.S. National Laboratory, they do the same experiment here at Kennedy Space Center to compare results. But there are some facilities within that lab that lend themselves very well to a situational awareness center. So we're right now in the process of implementing that with our technology partners. This is a little bit better picture of it. On the right-hand side is kind of a picture of the room, and then the left-hand side will be where we'll have the cyber analyst working at Department of Homeland Security. And that's our temporary space. NASA right now is implementing a new technology park on NASA Kennedy Space Center grounds called Exploration Park. The building over in the upper right-hand corner is the Space Life Sciences Lab, but all that area right now is under construction, and we'll have a top-secret facility there that will be working on cybersecurity education, situational awareness for the ISACs, and a number of things. So it's a very, very exciting time at Kennedy Space Center right now. You hear about all the doom and gloom with the people losing their job, but there's a tremendous transition period going into some new programs at NASA. But it's just a little painful right now while they go into that. So there's a lot of opportunities right there at Kennedy Space Center. One of the largest areas that we really wanted to help support was cybersecurity education. And in that, Dr. Ernest McDuffie from NIST, who is the lead at NIST for the National Initiative for Cybersecurity Education, he was one of our partners in standing up the Global Institute. We really wanted to work together to see how we could help support the NICE initiative. Now, as you probably know, I don't know if everybody knows, but there's 4 tracks for the NICE initiative. One is on national cybersecurity awareness, and I happened to be at the NIST workshop, I guess about a month and a half ago, where Liz and some folks did a great presentation on the Secure Our eCity workshop, and we got really, really excited about that. A track on formal cybersecurity education, which we're helping to support by developing sector-specific cybersecurity education frameworks for each of the national critical infrastructures. And we're starting with healthcare first because it crosses almost all the critical infrastructures. And then the 3rd track is on, of course, federal cybersecurity workforce, and the 4th one on workforce training and professional development for folks already out there in the workforce. This is a representation that the NICE initiative has really to show how we'll be a digital nation all the way going back through K through middle school. So when we build these education frameworks for the critical infrastructures that define functions, roles, responsibilities, competencies, sample job descriptions, mapping to security certifications, developing training and all, it's going to go back through K through 12 in medical school, K through 12 in middle school, to get that pipeline going. The NICE initiative just recently released last month the Cybersecurity Workforce Framework, which you can get online. If you go to nist.gov/NICE, they have a shortened version of it, and then they have a larger PDF document that goes into the details of what are the KSAs and functions and tasks within securely provisioning, operating and maintaining, protecting and defending, investigating, operating and collecting, analyzing, and support. So this really gives us a tremendous foundational baseline to build these sector-specific education frameworks, and we're going to be working to integrate what Secure Our eCity has done on the cyber awareness piece for the critical infrastructures. For the healthcare sector, we're just starting in January. We had a workshop this month in October to kind of kick the tires before we go on the road show. But working with HHS and FEMA and Department of Homeland Security and NIST, starting in January, we're going to have regional workshops around the country, bringing in healthcare providers as well as security technology experts, along with folks from HHS and FEMA and DHS and academia to define these frameworks. And National University is a huge strategic partner in this effort, and we are really, really thrilled that they're working with us, as well as iNetwork. One point I wanted to kind of share with you, which was kind of shocking, as you all know, the Office of the National Coordinator has given out, from HHS, has given out millions of dollars, to implement electronic health records to all the states and putting in health information exchanges. They also gave upwards of $75–80 million to a consortia of 82 community colleges across the country to develop fast-track health IT training. When we reached out to this consortia of community colleges to let them know about this effort, they told us that none of the training that those colleges had developed did anything on cybersecurity. So it was a big whoops moment for them, but they're going to be working with us, and they're wanting us to get started as soon as possible so we can implement training to help support the gaps that they have in those programs. So, looking at what Securing Our eCity is and what we've learned about the great work that y'all have done and what this program represents, it's really, just like you have, and I pulled this just from the website, having a line of defense against cybercrime where you live, work, and play, having public-private partnerships, protecting yourself and children, and defending organizations against cybersecurity, crime, theft, identity, IP theft, and really to implement best practices. It's all about connecting the dots. You don't have to reinvent the wheel. And this is such a tremendous program that we really hope to be able to utilize it to connect the dots for national critical infrastructure, protection, and really building that model within the health sector that then we can take that template and tweak it for finance, tweak it for state government, tweak it for energy, etc. This part I'm really excited about. Clarence Anthony was a mayor for 20 years in the state of Florida, and he was former president of the National League of Cities, which is an organization representing municipalities across the country, mayors across the country, and also president of the National League of Cities in Florida, former president. And he has come on board with the Global Institute, and we're first going to be working in the state of Florida to implement the Secure eCity program statewide in Florida. I've already met with the director of the Division of Emergency Management from state government from Tallahassee. And also, Clarence and Liz are going to be going to the National League of Cities conference in Phoenix. I believe it's in November, first part of November, to talk about how we can implement this on a national scale. Because I think, again, this is such a great program that all the work's already been done, and we just got to make it available. So with that, again, taking the eCity program and implementing it with all of the ISACs, as we look at how we can implement that with the National Health ISAC, we're going to take it and work through the National Council with all of the other ISACs, and hopefully work with the financial sector to see how they can leverage a lot of things in this program to go out to their sector. So that's kind of it in a huge nutshell. But, I'd welcome any questions, or, here's our contact information. Catherine Waldron, who's sitting back in the back walls. Catherine, hold up your hand. She's going to be moving here to San Diego the first of the year, maybe a little sooner. And so she'll be working very closely with National University and Liz and organizations, throughout this part of the country. So we're just extremely excited to be here and looking forward to working with everybody. And it's going to be, as I always say, when you get great minds together, it's kind of going to be scary what we all come up with, So we have a lot of opportunity. So I really appreciate the opportunity to be here, and if y'all have any questions, I'd be glad to answer them. Nothing? Okay. I think I'm through a little bit early, but again, my contact information, or if you want to talk to me after, feel free to give me a call. Thanks.